Hafsatu Ibrahim is a 35-year-old mother of 7 children. Hafsatu has been living in the Kwali Area Council for over a decade. Although the citizens in Kwali are predominantly farmers, she has never been engaged in any form of farming activities. She has been a full-time housewife ever since she got married. They have sufficient medical facilities, but we need more of mosquito nets and beds. Hafsatu tells us that she had 9 of her children in Darfur Primary Health Care in Kwali Area Council. 2 out of the 9 children died some days after they were born. Even though she has lost 2 of her children, she says she appreciates the continued support and care she has been receiving from this center. We are very grateful. We thank the workers of this hospital. May God bless them. Baby Haruna Ibrahim is the last born of the 7 of her children. He is 15 months old. Hafsatu says the healthcare center took care of her from the start of her pregnancy right up until the birth. After she gave birth to her baby, the baby's health became top priority for the staff at Darfur Healthcare Center. Members of the community are notified of when their babies and children are due for immunizations. They are on their toes trying to cut the rates of child mortality.
The FCT itself has also identified additional 2 health facilities for free antenatal care. And I believe when all these come on stream, they will further improve on the health status of our pregnant mothers.
All the patients in the center are grateful for the care they receive from the cheerful health workers, and as an added value, it's free.
This service is very good. At any time when you come here, they will attend us very well and they will take good care of us.
This center and many others in and around Nigeria are financed by proceeds of the debt relief from the MDG's office through the National Primary Healthcare Development Agency.
We have used the MDG, DRG funds through the Office of the Special Assistant to the President on MDGs to support our routine immunization. All the routine vaccines that are being delivered in this country to our children, to millions of children, are actually financed by the MDG office. They are distributed free, but they are financed through the MDG office. The cold chain transformation that we carried out in 2010, almost ₦1 billion of cold chain equipment, is actually being financed by the MDG office through the debt relief grants.
Professor Muhammad Ali Pate is the head of the National Primary Healthcare Development Agency, working with the Office of the MDGs towards improving maternal health and reducing child mortality.
One area that is key to achieving reduction in child mortality is preventing pneumonias. We're introducing new vaccines in 2011, pentavalent vaccine, which includes a new vaccine for pneumonia, as well as a pneumococcal, what they call conjugate vaccine. This will be provided with the MDG, by the MDG office really in our budget, and that is proposed in the 2011 appropriation. In addition, the MDG office has enabled us to support the training of mid-level managers in all the 36 states of the Federation, 3 mid-level managers per state, which is about 111 all in all. The first phase has been completed. We carried out that, we organized this course in collaboration with the MDG office, Office of the Head of Civil Service, as well as Duke University and the Bill and Melinda Gates Foundation. So it's a collaborative effort, but it's a one successful effort that is going to strengthen the management capacity at the front lines. So in terms of goal 4, child health, I will say that the MDG's office has been the really a key champion, and that it has provided a channel through which government is investing in preventing childhood deaths.
No child that dies is acceptable when there are, clear ways and means of avoiding those deaths. But recognizing them, recognizing that it's a local level problem, that there are a number of challenges, whether they're institutional, systemic, funding, manpower, the manpower we need for health resources, all these are major challenges. I think what we've done now within the health plan is to actually articulate that and to put investments behind them. The challenge of making sure that those investments are sustained and that they are scaled up is what we'll be facing in the years to come. Reaching the zero level is always everybody's ambition when it has to do with a mother or a child. And that will take some time. That will take some time. We have to recognize that. But are we making progress in the right direction? Yes, we are. We are reducing the number of children that are dying.
Today, as part of the efforts to reduce the high rates of mortality in the country, the agency, in collaboration with the Office of the Senior Special Assistant to the President on MDGs, have deployed 4,000 midwives to rural communities across the country. The midwives were deployed under the MDG's midwife service scheme to 652 primary healthcare facilities, which are linked to 163 general hospitals in all the 36 states and the Federal Capital Territory, Abuja. Recently, the National Primary Healthcare Development Agency has, with the funds provided by the MDG's office, introduced a system that will transform the country's health sector. The recently introduced initiative is part of the MDG's midwifery service scheme to train midwives across the nation with the use of ICT.
As part of the midwives service scheme, we decided to use IT as a vehicle for transformation and invested, supported by the MDG office, in IT infrastructure, linking primary healthcare centers, 200 of them, all over Nigeria, in this application, which has connected 40 general hospitals with our central hub here in Abuja, with video conferencing facility through which we have used to train midwives.
The agency has recently identified information communication technology as a potential strategy that will enhance implementation and management of the midwifery service scheme and indeed primary health care in general. Today, health experts, particularly those who are in care of women's health, can communicate to midwives across the nation and educate them without necessarily having to travel to the hard-to-reach areas in the country. It is believed to be the first of its kind.
The MDG's office supported us in the health sector to actually implement the midwives service scheme, which was flagged off in October 2009. And the office has been steadfast in supporting us to expand that scheme. So far, we have 4,000 midwives deployed in the 36 states and the Federal Capital Territory, in 1,000 primary healthcare facilities, all of them in rural areas. These midwives that we have deployed are actually delivering services to pregnant women, delivering antenatal care services, but also in providing supervised skilled attendance at birth. And what we are getting in terms of report is showing that tens of thousands of women are seen every month by these midwives that have been deployed in those facilities. In addition to just the physical human resources that have been provided, the MDG's office support has enabled us to improve on the infrastructure in the equipment, the training of not only the midwives, but also the medical officers in the backup referral centers where the midwives refer patients to.
However, despite all these efforts, Nigeria is said to be off track in achieving the reduction of child mortality. Children all over Nigeria have become vulnerable to disease and death due to malnutrition, unhealthy living environments, and lack of basic social services.